Have you ever felt a bit lost, maybe trying to find reliable data or the right measurement tool in a really complex field? Imagine a whole scientific area where the instruments, the very tools they use for research, are often just not quite up to scratch. Today we're doing a deep dive into a really interesting paper by Lewis and colleagues from 2015. It focuses on the Society for Implementation Research Collaboration, or SIRC, and their big instrument review project. Our goal here is to unpack how these researchers are tackling the challenge of finding good, validated measurement tools in what's called implementation science.
Right.
That's the study of how we actually get evidence, research findings into real-world practice. Think of this project as a shortcut, almost, to make sure the tool scientists using are, well, actually fit for the job they need to do. So, to kick us off, what was the core problem here? Why did SIC need to undertake something this, well, massive?
Yeah, it's a fascinating and fundamental issue, really. Implementation science, it's grown incredibly quickly, but it's been plagued, essentially, by a lack of psychometrically strong instruments.
Okay, psychometrically strong. What does that mean in practice?
It means tools that reliably and validly measure what they're supposed to measure, consistently and accurately. And these tools are absolutely critical for advancing the science, but the generally poor quality has really slowed down how we discover and apply evidence-based care. Previous reviews of instruments, they were just too limited in scope, maybe methodology.
Right.
So researchers were often left guessing. And without a clear consensus on which measures are actually high quality, progress just stays slow and, people end up duplicating efforts. It's inefficient.
Okay, I see. So SIRC essentially decided, right, we need to build a better mousetrap, or maybe a better scientific toolkit for everyone.
Yeah.
That sounds incredibly ambitious. How did they even start?
It was a huge undertaking. They developed this unique, pretty rigorous 7-stage methodology. Some key steps involved. First, really carefully defining the project's scope. Then, crucially, organizing all the instruments they could find using 2 very highly cited theoretical frameworks.
Okay.
You mentioned them, the Consolidated Framework for Implementation Research, CFIR, and the Implementation Outcomes Framework, IOF.
Right, the acronyms.
Yeah, they're more than just acronyms. They provided critical structures to help sort everything across 48 distinct constructs.
Constructs being the specific concepts they want to measure.
Exactly. Things like organizational readiness for change or fidelity to the intervention, these specific ideas. Then they did systematic literature reviews, and importantly, they really reached out to find even unpublished instruments, things not in the journals yet.
Oh, okay.
And this is really key. They developed robust criteria for what they called an evidence-based assessment, or EBA rating. This system looks at instruments across 6 main areas: norms, how does it compare to average? Reliability, is it consistent? Structural validity, does its structure match the concept? Criterion validity, does it predict important outcomes? Responsiveness, can it actually detect change over time? And usability, is it practical? And each of those gets scored from no evidence right up to excellent evidence.
Wow. So they're effectively building this impartial, expert-driven kind of like a Yelp review site, but for scientific measurement tools.
That's a pretty good analogy, yeah.
And then making it all open access for researchers everywhere. That seems incredibly valuable.
It is.
So after all this incredibly meticulous work, what did they actually find? What were the big takeaways or surprises?
Well, despite finding over 420 instruments, which sounds like a lot,
Yeah, it does.
the stark reality was that there are critical gaps. We're kind of flying blind in some really important areas. Many concepts, especially those in the outer setting, things like the impact of external policies and incentives or peer pressure within organizations,
Right.
had very few or sometimes zero available instruments to measure them.
0. Wow. Imagine trying to study policy impact without a tool to measure it.
Exactly. And even more striking, perhaps, was this. Even in areas that looked saturated, where they found maybe 20 or more instruments for a single concept, very, very few of those actually came from what you'd call gold standard development procedures, those rigorous steps that really ensure a tool is solid. On average, the instruments they looked at had passed fewer than 3 out of 8 proper development stages.
Fewer than 3. That's quite
It is, and maybe most concerning, about a quarter of the instruments didn't even explicitly define the construct, the very thing they were supposed to be measuring.
Goodness. So sheer quantity definitely doesn't mean quality in this case.
Yeah.
That really hits home. And this raises that crucial question. Why should you, listening right now, really care about the psychometric quality of these tools. If I'm, say, a health administrator trying to roll out a new program and I use a shaky measurement tool,
Mhm.
what's the real-world consequence? What does that actually look like?
Well, connecting it to that bigger picture, using unreliable instruments leads directly to unreliable research findings. And that directly impacts our ability to figure out what works and implement effective solutions in really critical areas like healthcare, mental health, education.
Right.
The real-world consequence is, unfortunately, wasted time, wasted money, programs that maybe don't achieve their goals, or we think they work when they don't, or vice versa. It slows down progress. So this SRC project, it empowers researchers, yes, but also program implementers and policymakers to choose tools that are genuinely robust. It helps prevent those missteps, those wasted resources, and ultimately it should accelerate how we get evidence into practice to make a real difference. It's really about building a stronger foundation for progress.
That makes a lot of sense. When you put it like that, the quality of the measuring stick itself is paramount. So, reflecting on this deep dive, what really stands out to you about this whole effort to measure progress in implementation science? This ORC project itself is designed to be dynamic, right? An evolving resource, constantly updated,
That's right, it's not static.
providing those head-to-head comparisons to help everyone make better choices. It makes you wonder. Imagine if every scientific field has such a clear, rigorously vetted catalog of its measurement tools. Just think how much faster we could achieve real-world impact across so many different disciplines just by making sure we're all starting with the right tools to build whatever better future we're aiming for.